You want to push into the ground, so you want to try and push your belly down. So hold my hand. I should not be able to move it.
And that is a good way. Some clients, like I said, some clients that are really, they've got to feel something, using that and saying, look, I'm going to try and pull my hand out, you've got to keep it there. That can be quite a good way to get that as well.
Right. So you need to push a little bit harder. That's it. Alright. Now holding that tension, can you bring one knee up to 90 degrees for me? Keep that tension. Don't let me hold my hand. Alright, and then slowly put it down on the ground again. Hold that engagement. Hold. Don't lift your back up. Push. Push.
I don't think I'm breathing.
Right.
Yeah, you meant to breathe through this.
Keep breathing. So you can hold your hand onto your belly there. Just make sure that you are still breathing. Alright, relax. Alright, engage. Alright, now we're going to try the other leg. Keep that tension. Bring that knee up to 90 degrees. Hold the tension. And then slowly lower down. Hold it, hold it, hold it, hold it, hold it, hold it, hold it. And no.
Sorry, just I thought, should we get somebody videoing?
Oh, I've got it.
Oh, you've got it? I'll see.
Alright, so this time I'm just going to take a little bit of pressure off for you there. Alright. So I usually have a ball.
Balls are good. Swiss ball, the big Swiss balls. Yeah.
Right. Obviously.
You could use potentially use a wheelie chair, might work. Not quite as good as a Swiss ball, but we don't have any.
Engage. No, don't do that. I want you to tilt. No. Right, relax. No, relax. Relax.
Yep.
Alright.
Breathe.
So you're just pulling your pelvis in towards you. No, you're going to do that. So you're tilting. It's like, here we go. Now take a nice big deep breath in. And you're just going to bring your leg off the chair there for a bit. And then pull your knee in towards you. And then go back down. Yeah, back to the chair. And engage. Alright, relax. Alright.
You see that?
Alright, so again, engage. So just no, don't push up.
Okay.
Alright, I just want you to tilt. So imagine that you're putting your pelvis in. There you go. Hold that engagement. Alright, lift your leg up off the chair, the other one. That's it, hold engagement. That's it. And I'll slowly lift it back. Hold, breathe. Yeah.
This is why I don't progress people until they can breathe. Yeah? The biggest change I would say between what I do and what you do is I utilise the breathing a lot more. Okay?
I'll start coaching them from here on.
Yeah.
So, because I want to see what they do for this.
Okay. Yeah. I'm sorry.
Alright. So as you lift the leg up, you're going to take a deep breath in, hold that engagement, and as you lower it down, I want you to count to 4 nice big deep breath down. Okay? Alright. So engage. No. Don't. That's it. Alright. And when you're ready, breathe in. And as you go back down, keep your breath engagement. That's it. Count to 4. Engage. And that's it.
I don't have very good.
None of you will.
Can you explain the purpose of the Swiss ball over something stable like a chair? Is it just because they're having to hold it there? It's
Yeah,
more-
she'll want to. She's gripping with the. She's trying to pull it in. So as soon as I say engage, she's immediately pushing out. So Swiss ball, they relax more because the ball is softer, so that he'll sink into it rather than trying to.
Okay, but you're still lifting the leg off it, eh? They're not rolling it in or anything?
No, it has to be a lift.
And does it matter what size Swiss ball? Do you want it to be about
You want a
90 degree?
smaller one? Yeah, if it's too big, then they'll be up here.
Yeah, because I've got a big one at home. But
Yeah, ideally you can get the kind of medium ones, which are, for most people are
But
about.
you can even use a chair.
But you can, you can
Yeah,
use
the
it.
chair is good
It
because
doesn't.
it's not going to go anywhere.
It doesn't really matter.
So once from that, if they can do that, then I'll start them from the ground up.
Yeah.
And then once they can do that, they can do it from the ground up, then I'll get them to do a leg drop.
So do you want to yourself demonstrate it quickly, how you progress them through?
Me off.
Yeah.
Me.
Just to so they can see.
I can't talk and do it.
That's okay. You don't have to.
or from there. So there. This one?
Yeah.
The shape.
Any other exercises you do?
I'll start them from the rolling C, coming up into bridge.
Yeah.
And then as I go down, rolling down,
How do you get their breathing through that?
breathe in on
See
the
if you do it something. Any variations in that? It doesn't have to be, I'm just asking. No?
No, that's basically, it's just that whole, so that they roll with, so that's the wave that I do.
Yeah.
There's compression at the top, and then as they breathe out, they roll into the wave.
Yeah.
Push everything, almost have the feeling of pushing everything up.
And so that's all on? Yep. Okay. I'll show you a few variations. So, I don't like bliss. You can use low ones, personally. I don't like them. That's just because I've got a bad neck.
Yeah.
Yeah. If I get put in
I've
that
got a bad
position,
neck,
I'm
that's why I have to use it for
no, I get really severe headaches because my neck is too forward. Yeah. So, again, I would generally have them, I think you did the hands on, at least one hand on the lower and upper, because the same thing, so many people, and I noticed she did it, she's trying to breathe, just straight away. This is why you get them practicing the breathing just as breathing first. Yeah. And depending on what the client's condition is, obviously would depend what exercise I'd progress them on. But essentially, the very first ones that I do are pretty much the same. Can they just lift off, lifting up, can they lift off from here? I do normally like a heel tap first before an extension, but the breathing is essentially the same. I just, like I said, really trying to get them really pushing this hand up through all the movements. Yeah, so they should be able to get a really nice movement with all of their breathing through each exercise, and I really get them to focus on that. So, you know, if they're lifting the leg, I expect them to get keeping that engagement so that they can feel it. So I always get them to do that first. I always get them to do a couple of breaths, and that's their first exercise. I could say is engagement with the breath. Then they've already gone, okay, this is how I do it, and then they add the movements on. If they go straight into the movements, it never works. Right? So always get them to do a few breaths first, and really get them, and it's something if you guys practice, really try and get that really nice movement through the abdomen with each exercise. Yeah.
If I have a client who obviously it's the whole like at the end of it, would you progress or would you just stay with getting them to get that normal breathing?
So get everything done perfectly before moving on to the next step.
Otherwise, they're gonna compensate. Yeah. So ideally, you want them being able to do a nice big, and you should really see that. You know, it should be really obvious. Yeah. You should be able to really blow up the abdomen. Yeah. And it's the same then, so for example, if you're lifting the leg, you want them to breathe out as they lift it up. They should still get that full expansion and down, keeping that activation. If they can't do that, they're not ready. Yeah. So yeah, I do heel lifts, same heel lifts, and then can they touch down? Once they can touch down, I might get them extending out. Yeah, as long as they can still do the breathing through it. Yeah. You can also do double taps, but that's harder again.
For someone with quite a lot of lordosis, how would you,
Well, once it starts to strengthen, that should actually lessen as well.
Yeah.
A really big lordosis generally is weakness. So as that starts to strengthen, that should slowly come back a little bit as well.
I don't know if you agree, I usually, if they've got a lot of lordosis, I put them to put their hands under their back as a little bit of a stabilisation until they get their breathing right.
You can very initially if they're really struggling on the breathing.
Yeah.
The problem with doing that is it becomes very reliant. So
Yeah.
I might do it if they're really struggling with the breathing, but I wouldn't get them doing exercises
No.
until they could do it without that.
Yeah.
But yes, initially, if they are really arched and they actually physically can't do it, then yes, you can do that. But you have to get the angle right because it can put them into more if you get it in the wrong place.
Yeah.
Yeah.
So you think about stabilising through their sacrum.
Yeah, so it's literally under. Yeah, it's not. If you go too far, which way? Hang on.
Up.
If you go too far up, it can be.
yeah, cause I was thinking even when I'm doing anything core exercises, now I'm realising that I haven't been activating my core properly, but yeah,
Might
I
do
put
this.
my hands under, just under,
Yes.
basically lower
And
bum.
that is because it cheats.
Yeah.
Essentially, you then don't have to turn on your transverse abdominis.
Yeah.
And that defeats the point.
Cause that's,
really.
I can't do a leg lower without,
Yeah, because
rolling onto my.
that does that for you.
Yeah.
Yeah. Then we want them doing that themselves. Yeah. I do the same. I do use the bridges. There is, so the first one I would agree. I would do exactly the same. Where they breathe in on the way out. And then roll, and it's a real roll. You really want them kind of rolling, so as they breathe in, it's a real kind of roll up, and then a roll reversal down, and then they can relax as well. You can also, I would then get them to do it as a double breath. So it actually, once they've got that comfortably, I actually reverse it, so I get them to breathe in before they go up. So most people get their hands by their sides, so actually get them to breathe in on the ground. And then as they go up, I'm gonna breathe out. Then here, holding it,
And breathe out all the way down.
and then breathe out on the way down.
What's
So
the purpose of that?
it's hard. Literally.
Yeah.
Because they're having to hold.
You're doing a concentric
Engagement.
traction on
Yeah.
the exhale.
So you're reversing the type of.
Yeah.
You're reversing the type of traction, so it's hard.
It's easier to breathe in the centric.
Yeah, way easier. And I will do that with a lot of the exercises. Once they've got the initial one and they're getting better at it, sometimes I'll flip it on them and I'll reverse the breathing. Yeah. But only once they're very good at the first one. You can obviously then for the thing to watch with this one is obviously, especially if you're looking at pelvic stability, is if they're doing something like this, it has to be even. And then if you want to further progress pelvic stability, obviously you can lift your arms up. That's going to make it harder. Or you can, again, I would not normally do this until they're very good. You can obviously then, either cross the arms, or you can look into can they change their weight. Yeah, but that would be a very end progression. It's a very progression for when people are really starting to get good at it. I also do use bird dog or Superman, but it's very specific. So I would normally, you can, now again, depending on what the person is coming for, sometimes I will use, I call it an activation crunch, because it's not a crunch as in a, sit up crunch, it's literally an activation one, and generally, especially if I've been strengthening their neck, I will tend to use this, but only once they've progressed through the neck strengthening stuff. So most people obviously are SCM dominant, right? And when we come to neck, we'll do it a little bit more. But to turn deep neck flexors on, some people have to go through exercises for that as well. And essentially, the first exercise is, it sounds a bit strange, but pushing your tongue into your mouth and tucking your chin. Alright. And some people can't do that. And then once you get past that, it's then obviously from here rolling, which we just said that. So if I've been doing that with them, and I've been trying to strengthen that, I might turn that, but I wouldn't do it with everybody. It would obviously depend on what I've kind of done with them. But you can utilise the breathing and do the same thing where you, again, you would either do it as a breath in as they come up and then a breath out, or you can progress it so they come here and then they breathe in and then breathe out going. But again, I would normally only use that if I'm doing something kind of more upper body as well. But sort of just kind of throw it in the middle. But we will go over that a little more once we've done kind of more next stuff. The other one is, you're saying bird dog. Now, so do you use that?
Me personally, no.
No, do you?
Not for a long time.
I actually used it in my first exercise for my case study this time.
Do you want to show it then?
Tick.
Not just do you want to show it?
Come on.
Come on, no, let's give somebody else a demo. You do it on somebody. Or you can talk me through it if you like. Because then I can modify it if I need to. How would you do it? How would you talk somebody through it?
Well, I asked her.
Or do you want to show it? You can
No,
demo it yourself.
I
Demo it
always
yourself.
demo, and I'm with him.
I personally, I always demo myself
Yeah.
first before I get them to do it so that they can see it.
So I would always make sure that the engaging cord, which obviously I can't. But yeah, no engaging cord, make sure their back is neutral and they've got even weight distribution on each arm and leg, knee and leg. And then you would do one arm out and the opposite arm back. So I would go out and you hold for 5 seconds and then you come back in.
Okay.
And then you do the other.
Do you do it differently?
Obviously, yes.
Show how you do it, and then I'll see if I do it the same as you.
I feel like I'm under the microscope.
So what are the?
That's
what,
right.
So why would you choose this exercise?
I was trying to gain some core strength, strengthen up her glutes and try and neutralise her and make sure her spine's, and yeah.
Yeah. Anything else? Balance. Yeah. Anything else?
Facial stretching.
Cross. Yeah.
Of course.
Cross stretching and strengthening. So this also, again, this comes into shoulder, which we'll be moving on to. But yes, this also, because obviously, let's be honest, most people are in shoulder protraction, so you're going to be doing some form of shoulder stability with them as well, theoretically. This is a great cross-train, stretch and strength. Yeah. But there are some very key points that when you do it, you have to watch, which most people don't. And that's why it becomes a hazard. So a lot of people hurt themselves doing this because they're doing it wrong. Yeah. Okay. Demonstrate. Let's go ahead.
Can I just demonstrate or do you
No,
want to
just
talk?
no. Well, demonstrate it, and then I might ask you why you've done these. He's a bit shaky. Oh yeah, I don't know what you mean. Like I said, I'm still working my way back through mine. Mine are all a little bit on the shaky side, so. Yeah. So key points, what would you say?
Hips become a really big thing.
Yeah.
This one, so because people are generally not aware of what the hips are doing, a lot of people do that.
Yeah.
Sorry.
That's okay.
Yeah.
That's fine. It's good to learn.
They do a complete drop
Stretch. Yeah.
normally. So the shoulder often it'll pop out or wing, and the hip will go. Thump. Okay. You don't want that. Okay. So how? So would you always go straight to a arm leg?
No, so I would generally do opposite arms first, just so that they can get scap.
So like
So it's all
just
about
arm.
scap engagement, so making sure that they're not doing that or that. So
Yeah.
setting back so that you're straight. I generally put a book or a small weight plate on their back so that they can feel what's happening to their hips. A lot of them will do something weird. So scap there and then just try and lift arms up first to see if they can distribute their weight but still keep that activation without dropping side to side. And once they can do that, then I'll get them to do leg.
Okay. So because we're doing a little, I know we haven't actually done shoulder yet, but we're going to talk over a little bit of shoulder stability here while we're doing this. Why, we were talking about, you know, position of the shoulder. What are you looking, what do you guys think? Obviously, I know we haven't actually gone through shoulder yet, but you guys know your anatomy and stuff, so it shouldn't be too bad, even if you haven't treated them all. What are you watching for with shoulders? What don't you want them to do? How should a shoulder sit?
Back.
Yeah, so there are a few things that people will do. The first one is this. They'll bring their shoulders into earrings. You know, they will literally bring their shoulders right up or like kind of push their neck in. Okay, that's the first thing to watch. Second thing to watch, as you said, they'll do this. They have a real severe drop, or they'll do the opposite and they'll push like right up. Yeah, no, that's good. Or you get the ones, I can't even do it because I've done too much shoulder rehab. They'll literally like pop off their backs. And like, yeah, sometimes it is hand position. Like you said, they kind of somehow do this sort of thing. I'm not quite sure. I can't even do it. So the key, one of the key things is obviously to start with is hands forward. I always ask them to put their feet flat too. Don't do this. Feet flat. Get into a nice kind of box shape. Shoulders should be down, so they actually need to retract their shoulders, and this comes into part of the shoulder rehab stuff. But they do. Most people can't actually retract their shoulders, so that's the first step. In terms of that, they might not be able to do it. So, but that's something we'll be doing in shoulders. So you want these shoulders to be kind of pulled down, and then they need to be flat. You don't want them pushed up too much, but they can't be sunk either. So you want them nice and flat. The hips also, obviously, again, you want them nice and flat. You can, like I said, you can use a book or something like that. Nothing too heavy though. You can also actually put some people will use like a broomstick or something, and that also keeps the head, because some people will do this or they'll do this depending, whereas if they've got something there, that also keeps the head neutral. I personally prefer to just use my hands when I show them, and then I normally would get them to either video themselves or have a book or something like that. But some people like the broomstick. It's up to the client really, also what they have, how they what sort of kind of learner they are, things like that. So once they're in a good sort of back, shoulders down and kind of neutral, and hips straight. I would always start with, can they just transfer their weight and lift a hand off without doing, you know, something like this or like this. Most people, even just being able to do that, holding quite steady, there would be a huge kind of weight transfer or a transfer through the hips. And it's the same with the leg. Can they, keeping steady, can they take the weight off and just slide the leg out? They should be able to stay pretty much no movement through the back. And that obviously, you know, it's the same position as when you're down on the cores on. And I would use breathing as well. So breathing in and out with the movement. So when they're here, can they breathe in, lift off, put it down, and breathe in, breathe out. Can they stay nice and flat? If they can do that, then I would slide up. Can they actually take the hand right off? Some people, they'll do the initial okay, and then as they do this, they'll start doing something like this. Yeah. So they might be able to get past the initial stage, but then as they go to move, they start compensating. So that would be the next step. Can they actually slide out, lift off? And you know, to start with, they might be able to come to here, and that's fine. And then, you know, you might build them up. It's the same with the leg. Can they come out? And then if they're still staying stable, can they lift off?
So Amelia, you might give them, this might be, because I feel like we've been doing case studies, not case studies, but doing clients, and we've been giving them, you know, lots of stretches, general stretches every single week. But would you focus on more doing this one over a course of, and then like
So,
literally one, but get it really, really like.
So normally what I do, depending on how many issues they have and what I'm working on, I will always give them a week or two of just with the breathing stuff first. Once they can get that activation, I would normally give them, so my program, I generally will give them the initial leg, like so they'll do a leg lift, as in, you know, they'll be doing this one. and then they would have the initial stage. If they can do that okay, then I might try that one. If they can do it, I'd give them both, plus the initial stage of this one. So they'd have the initial stage of kind of all three. And I would build all three up in different progressions, depending, because some they'll be able to do a little bit better than others, depending, again, on what else is going on. So generally, I would give them kind of one of each, the initial stage of each, and then build up the progressions of each.
What's the kind of like amount of reps and stuff that you get them to do?
That is really dependent on the person.
So you test it with them. If they can only do 5, you give them up to 5.
So again, generally with the breathing, once they can do 2 sets of 10 breaths holding that on, then I'd give them exercise. Well, exercise. So I'd start these progressions. And I would drop those progressions because I want them, again, most people I'd be doing shoulder stability and hip stability. So I want them to be able to do all of the exercises. So they drop back to 1 set and they would start with 5 reps. Generally of each, build up to 10. Once they can do that, then I might drop them back to like 8 and do 2 sets. Then I might drop them back to 1 set, but progress it. I don't always progress all of them. Actually, I pretty much never progress them all at the same time. They might progress one week, one the next week. Okay, so there's always a slight, generally there's always a slight change, but it's normally only a change in one thing. Otherwise it's too much.
So Amelia, before you said that you do the breathing at the beginning of your session, and how long would you do that for?
Just take them through their breaths, like their reps.
Oh, okay.
Or do you mean when I'm
I
teaching?
just mean like how, like minutes, how long would you?
Oh no, I always go on breaths. I always work on breaths. Yeah. Same with the, I always work on reps and sets. I don't generally work on time, because the problem with time is that you can overwork somebody. If you say do your breathing for 5 minutes, they might only be able to do 3 breaths, but then they struggle to do their 5 minutes. So I always work on the amount of breaths that they can do well. Same with the exercises, I work on the amount of reps they can do well. Soon as they, and honestly, I might let them do 1 or 2 reps, which is a little shaky, and that's it. Soon as they start doing the shaking, again, like I said, I might give them 1 or 2, because you do need them to push a little bit, but more than that, and their form starts to drop too fast. Normally you can do like 1 to 2 reps which are a little shaky, and then they'll just, nothing, their technique will just fall apart, right? So generally, I'll let them push a little bit. Again, like I said, 1 to 2 reps, that's it. Because then their technique just falls away. Yeah. And as soon as that happens, they're not doing any good. So they're better off to do a few really well, and that's it. So it's the same with this. So once they can do, kind of lifting comfortably, that is when I would start to go, okay, can they? But again, I would start completely on the floor. Can they do that without movement? And then can they lift? You can, again, a really advanced level, once they can lift comfortably with no movement or very little, then I might kind of almost progress them back where they lift an arm, but they do circles or squares or something, right? But that would be the advanced stage. Yeah. Most people, to start with, you will be just trying to lift off, and they won't be able to do it, well, not very well. But again, you do kind of have to bring the shoulder rehab into that, because most people, like I said, I would also have a, do you guys think you're confident enough to go through, like if I was to show you scapular stuff, you'd understand all the muscle, you should, yeah. So most people, obviously scapular, and when we go over like scapular humeral rhythm, most people have an issue with scapular stability as well. A lot of people wing, or they're really protracted, or they're rotated or something. Most people have an issue with their scapula of some form. Most people are also different side to side. Pretty much all of you will probably see to some extent. Most people, like I said, they are very limited in scapular retraction. So most people, even if they're sitting here, they can't really depress or retract their scapulas that well. Most people are kind of in depression anyway, so being able to depress, pull down, engaging lower traps, it's very weak, if it all existed. Most people are also weak in serratus anterior, so they won't. So those are the 2 things we well, at this stage I'll talk about, because we're doing this, that I would use kind of in combination a lot with the pelvic stuff. So it'd be depression and serratus to suck those scapula back on the thoracic cage, because they should sit on each other. You know, your scapula shouldn't be lifting off. Yeah? Most people are in some form of winging, whether it's a winging with rotation or a winging with abduction or something. There's normally some form of weakness through serratus anterior, because that is what pulls your scapula back down. Makes sense? You guys all know where serratus anterior is. Awesome. So there.
Oh my god.
Don't do that to me. Gave me the sweats for a second there. Yes, serratus anterior. Well, it is anterior, kind of.
At the back, she said, is it at the back?
Oh, it's on the anterior side of the scapula, but it is posterior, but it's anterior posterior.
Yeah,
If that makes sense.
yeah.
It is. It's one of the most confusing ones, because it's anteriorly on the scapula, but it's posterior on the skeleton. Yeah. So, does while we're on this topic, who does any shoulder stability stuff? No. You do a little bit. What do you do? For the
I've had
specific.
massive shoulder issues.
So have I. This is why I know so much about shoulders. The amount of rehab I've done around shoulders and pelvis myself is just ridiculous. What specifically around what we're working on today in terms of basically, like I said, serratus anterior and kind of lower traps. What might you do them? Just so that we can combine it, because these are in combination. Obviously, we will go over more shoulder stuff when we actually get to the shoulder, but these do work so hand in hand that it's kind of silly to not go through them. So
scap retraction.
yeah, so come demo, and I'll see if we do it the same.
There you go.
There are normally a few variations. Some people do some variations, some people don't. So
The scap setting.
yeah,